Let's head on over to the Eastern Cape now, where government there has requested that the South African National Defence Forces medics be deployed to the province. Pressure continues to mount on the province's health system. There has been a spike in COVID-19 cases. Now, experts say the province's embattled healthcare system is being stretched to capacity with the increasing demand for high care and intensive care unit beds. The Eastern Cape Coronavirus Command Council has briefed the media as well a little bit earlier. For more, we cross to our reporter Yanga Funani, who is in Bhisho in the Eastern Cape. It's a good afternoon to you, Yanga. Certainly getting word then from the Premier. It's a dire scenario, a dire situation, but will hopefully follow protocol as much as possible in accordance with the rest of the country.
Can you hear me?
I'm not sure if you can hear us, Yanga. Just getting a sentiment and some thoughts from you then. If you could give us a quick highlight with regards to what the Premier had said a little bit earlier and whether he had really just said he would follow through with regards to what the National Command Council has instituted in terms of the rules, the laws stipulated, whether it be healthcare professionals or teachers and educators as well.
Yeah, she's out of the show. Okay. Very good afternoon to you, Arabile, and to our people. You're coming to us live from Bhisho moments after the Premier of the province, Oscar Mabuyane, briefed the media on the update of the command team, coronavirus command team in the province. Part of the things that he mentioned is that the province is beefing up its capacity. Its capacity in terms of ensuring that there is enough medical staff in hospitals of the province. One will remember that the province has been struggling with protests of staff in various hospitals of the province. As we speak at SS Gida, the staff there has down tools demanding PPEs, something which is unbecoming, especially as we approach 100 days of lockdown. Now, we are joined by the Premier of the province, Mr. Oscar Mabuyane. Tell us more about this. Sir, you painted a gloomy picture in terms of the status of the fight of COVID-19 in the province. What is the government doing to ensure that the health sector doesn't collapse?
Good afternoon. We are doing everything possible in our power, of course, with the support that we are getting from the national government. National Minister has been always available to assist, and we're sending a human resource capital into the province to beef up our teams administratively and otherwise, but also we are dealing with fundamental issues that creates this sense of uncertainty. We knew that at a particular point, if we can't manage successfully to contain this surge of numbers, we will be seeing ourselves in a situation where we are gravitating towards, because numbers are growing faster than we would have envisaged. It's not an easy thing, and of course our system is being overwhelmed, but numbers that are still hospitalized are still lesser than the number of beds that we have. We've decanted hospitals, we've created beds, we have procured beds that are waiting for deliveries into hospitals that we have converted from TB hospitals into COVID-19 hospitals to ensure that we increase our capacity. We are delivering the additional beds, hospitals that have been done through public works. Government is concluding the procurement on the field hospitals to create more bigger capacity of additional 4,000 beds that we are looking for. We are looking for almost 10,000 beds if you look at the situation and the rate at which the infections are currently taking place. So we are hard at work as provincial government in ensuring that we attend to that. Yes, of course, we have set up systems in place. We are working with the labor. MECs is able to meet their mechanisms. We have formed joint monitoring teams with the leadership of the labor to ensure that any teething problems that arise out of sites, healthcare facilities are attended to on spot. We are saying we want to protect frontline, and we don't want to see our doctors and nurses being exposed to the COVID-19. We are seeing this every day, but also the problem that every time there is one person who has tested positive, it collapses the system. There is something wrong with that kind of behavior. But what we're saying, where that case happened, you can't close the hospital because there are patients in the hospital that must be looked after. This is an essential service, which we must always do, but government must always respond swiftly. That's why we talk about agility of government. Respond swiftly in terms of decontamination of that particular site, in terms of ensuring that there is always enough PPE. From where I'm seated, I always get a report from the department that they are always distributing PPE into these hospitals. So we still need to really fathom, to understand exactly what makes this issue of the PPE to be really an issue to always hide behind when there are these kind of issues. Of course, we're observing the issue of anxiety, fear, and our people are scared about the virus, which is very unfortunate. It's not a virus for the first time. These professional people have been trained on how to contain and how to manage viruses. We still need that skill from them. That's why we're doing everything to ensure that we protect them. And I'm actually hard on the MEC and the department that we don't want to see these cries of our frontline services. These are people that we must prioritize in everything. Where there is an element of unhappiness, go there and attend, solve the problems on the spot, so that we are able to make it a point that our hospitals function at their optimal capacity. Of course, we have got a challenge of our healthcare facilities. It's something that is chronic, something that is historical. We knew we have got a challenge of health profile in our people in the province, older people with comorbidities. So we are seeing the effects of those now as numbers are surging and also as more people are succumbing to the virus.
Okay, I like how you mentioned the anxiety of the health workers. Is that why you are roping in the services of the South African National Defence Force?
Definitely, we need to cheer them up. We need to find an inspiration, but we also need a resource. But our province is very vast, very geographic vast. The bigger part of our population is on the other side, the eastern part of the province. And we have got serious challenges of the healthcare facilities there in terms of capabilities, etc. And this is where we are seeing a new emerging cluster coming up there in terms of the spread of the virus and numbers growing. There's a serious exponential growth that we're seeing, observing that side. So we need that capacity from the South African National Defence Force to come in, but also to help us anchor those big hospitals where you have got this problem of infections. If one person has been infected, the entire team and the entire shift collapses. There is something that we've got to work on. That's why we have said, let's actually reinforce also on the psychosocial support, so that nurses and doctors, especially nurses, understand the nature of the job that they are doing, understand the level of patriotism that is expected from them as we speak. Without them committing themselves in the manner in which they've been committing themselves, so we'll have a problem. The system can easily collapse. So we can't afford to see the system collapsing at a point when our people really need help.
Now, experts have said that, Mr. Mabuyane, this virus actually brought into attention the fact that the health system of the Eastern Cape had long collapsed before the virus came into our shores. What do you have to say about that?
That can't be correct. We are currently at a 54% recovery rate of people who have been infected. And these people, most of them have been supported through our health facilities. We've been having our hospitals attending to these cases. Many people have been discharged from these hospitals. So it can't be correct to say it has since long collapsed. Yes, we have been coming from a low base in terms of capability as a province. It's historical. It's not something that has just happened. COVID-19 has just brought that to bear. It has just exposed us to the reality that the work that we were trying to do on NHI, trying to increase capacity, trying to provide appropriate healthcare facilities that are needed for such NHI, we needed them now, not in actually 4 years' time from now. So that's an issue that the COVID-19 has done. And it has exposed the entire government of South Africa about the spread of development in the country. And Eastern Cape has been there. Eastern Cape needs that kind of care. That's why national government has been coming, if you look at education, coming through the ACD, eradication of mud schools, coming through NHI as a pilot site, building proper facilities, clinics in our rural areas. So it is because we've been having that kind of a backlog that we inherited from the former Transkei, former Ciskei, etc., and as well as Republic. So working around that is going to take some time, but it's a commitment that government is doing. It's a kind of a challenges that we have, and unfortunately now, because people are panicking, because there is this fear, and we can easily collapse. This is the time where we need leadership. This is a time where everyone in your household provide leadership, stand up, assist, because if we are able to make people not to move around, people to stay at home, there will be no pressure in our healthcare systems. There will be no heat that we are feeling now, and where the system is being overwhelmed, because we will stop the spread of the virus. But if we can't, with the people moving around, as much as we are testing, and we are testing numbers every day, and we have seen the rate of 1,000 daily rate that we have been recording. These are issues that we are looking at. But as government, we are doing everything in our power with the legal resources we have. And this has also brought the reality of the primary health care that we need in our country. It's better to prevent than cure, because curing is expensive.
Thank you a lot, sir.
Thank you.
Arabile, that's of course the Premier of the province, Mr. Oscar Mabuyane, telling us about the interventions that the government has in place to ensure that it rescues a dilapidating healthcare system, public healthcare system. Also, over 8 billion has been set aside, has been ingested by the National Treasury to ensure that the system doesn't collapse while people are most needing health services. As from us here in Bhisho, it's back to you in studio, sir.
Yeah, Yanga, thank you so much for that reporting then out in Bhisho and the Eastern Cape, of course. Then the situation there, of course, getting as scary, if not scarier, as well as time continues to progress. Even Gauteng's cases, of course, hopefully set to reach its peak in about 3 or 4 weeks' time, according to the health minister of the country, that's Dr. William Kize. Certainly will get interesting. We'll have all the news headlines for you here, of course, on SABC News.